Dreaming of a better sleep? Tossing and turning is not your destiny. And Ollie is here to help. Ollie invites you to sink into sweet, sweet slumber to improve your mental and physical health and overall wellness. More than just melatonin, Ollie's ingredients help you unwind your mind for a delightfully dreamy drift off. Sleep is on the way at Ollie.com. That's OLLY.com.
Today on CityCast Boise. The Treasure Valley used to be a popular place for doctors to practice, but now, nearly 1 in 4 OBGYNs have left Idaho, according to a recent study. Dr. Caitlin Gustafson is the president of the Idaho Coalition for Safe Healthcare, a group involved with that study. She's here to explain the repercussions that this exodus will have on your healthcare. It's Wednesday, March 13th. I'm Lindsay Van Allen, the new host of CityCast Boise. I'm excited to be here having these conversations and more about me some other time, but for now, this is what Boise's talking about. Dr. Gustafson, thanks so much for making time to come on CityCast Boise. I really want to jump in with a question that's on everyone's mind. Is it safe to be pregnant in Idaho?
I think that it is a very scary time to be pregnant in Idaho for sure. Not only are we dealing right now with an exodus of providers that we're going to talk about today that has put further strain on a system that was already strained even before. We've really lost a whole system of care from the top of the highest risk providers, our maternal fetal medicine docs, our perinatologists. Losing a good number of those folks in light of the laws that have come through in Idaho post-Dobbs has created a difficult scenario and system for patients to access care, particularly when they have high-risk pregnancies or complications of their pregnancies.
Absolutely. And then when they have trouble accessing care, obviously, like we've talked about, that trickles down to all of the other providers, all of the other patients. It has a ripple effect, right?
That's right. Most patients will start their care, their pregnancy care, with either an obstetrician or a family medicine obstetrician or a certified nurse midwife, in most cases, if they're planning a hospital delivery. And just getting into care right now can be a challenge because of the loss of providers that we've had, the growth of the population, and that just creates a system where patients from the get-go are having trouble getting seen earlier in their pregnancies. Then as complications come up, a typical scenario would be for that obstetrician or family doc or midwife to refer them to a maternal fetal medicine doc. And that also is a challenge, just getting those appointments, accessing that care, depending on where you are in the state. But even in the Treasure Valley, we had 9 maternal fetal medicine physicians that those of us providing this care, including myself, around the state, were new. We were very comfortable with those providers. We had worked with them over years, and we have lost 5 of them to leaving practice here in Idaho. And, we're lucky that we've been able to secure some locum tenens. Those are temporary providers who come in and provide that care and those consultations. But that's not the same system of care that we started with. And when you lose that trusted provider who you've seen in a previous pregnancy, or that your obstetrician or family doc or midwife has referred to in the past in similar situations to yours, that's a huge change to the system. And to your original question, yes, that eventually has a trickle-down effect on the safety of pregnancy in Idaho.
Let's go back in time just for a minute, kind of set the stage. When the Dobbs decision was leaked, I was working in the hospital as a nurse, and it felt like there was this instant tension because Idaho's abortion bans targeted doctors, and that would likely mean doctors would have to leave. And this terrified me. And since then, in the healthcare community, we knew doctors were leaving, but didn't have solid numbers about how many had left until now with the post-Roe Idaho report. When you look at this data, what scares you the most?
There are many things about the report that scare me. I've been very close to this process and this data from the beginning, and the understanding even before the report came out, even before the year had rolled on and folks had started leaving, that this was a very ominous issue for the safe practice of medicine in Idaho, and that many physicians were considering leaving just on the basis of these laws being passed and how they threaten their practice and their life, in the sense of, if you face criminal charges for the decisions you need to make in the exam room or in the hospital on call, that's just a terrifying place to be for physicians.
Yeah, and it like you said, it was ominous, but with this new report, we found out Idaho lost almost 1 in 4 of our OBGYNs. Do you personally know any doctors, colleagues, or friends who have left?
Absolutely. And Idaho really is small in the physician community and the medical community. Several of my colleagues who I considered friends left as a result of these laws, as well as a good part of the referral network that I have from my rural clinic for my high risk pregnant patients.
Did they talk to you at all about their decision to leave or what led to their decision to leave?
Yeah, I think, without speaking for anyone else, because these decisions can be, complex in the sense of, how long you've been in the state, how long you've established your practice, what other connections you have in other states where the practice of medicine wouldn't be threatened. I mean, there's nuances to that decision, how close you are to retirement or to stopping obstetrics as part of your practice. For a family physician, you can choose to stop delivering babies and providing prenatal care and still, stay in, maintain your family practice. For an obstetrician gynecologist, you can continue in some cases, your gynecology practice while stopping obstetrics. So these laws have had trickle down on all of medicine for sure. And it's not limited just to maternity care. You can limit the exposure that you have to specific criminal charges around the practice of medicine by no longer providing, obstetrical care specific to these laws. Now, all of us have, like I said, we've all experienced that sense that you describe of fear when you hear about criminal charges. I personally, yes, heard this from many colleagues that this did not feel tenable, that staying here for how long to see if this could get resolved, for the public to understand the impact on their care. And then I think the other really important piece of this is that it hasn't just been the bans on abortion care that are some of the strictest in the nation, that limit our ability to intervene when the health of the mother or the fertility of that pregnant patient is at risk. We've also seen other attacks on maternal and child health care in Idaho during this exact same time period in which obstetricians were leaving or considering leaving, as this report describes. We also suffered the loss of our maternal mortality review committee. We also saw a failure of the legislature to put through protections for postpartum women for the extension of Medicaid coverage to a year from 60 days. So all of this added up and also contributed to some of these obstetricians leaving.
Well, and you just brought up the maternal mortality review committee, and that, maternal mortality was discussed in this report, and it showed that Idaho is in the 10th percentile for maternal mortality outcomes, which means 90% of the country has better maternal and pregnancy outcomes than Idaho. Do you think the quality of care that doctors are able to provide has been impacted because so many doctors have left in such a short amount of time?
Absolutely. I mean, we know the studies also bear out that access to care is a critical piece in decreasing maternal mortality. We have, we are a very rural state. So clearly in our rural areas, we've seen patients traveling longer distance with sometimes high risk pregnancies to access the level of care that they need, or even to access a functioning labor and delivery unit. But this access to care issue exists in the Treasure Valley and our urban areas of the state as well. We know we're seeing, closures that affect the Treasure Valley and surrounding counties. We're seeing patients travel farther distances out of their county to access the care that they need where it was previously provided. We're seeing groups of physicians not be able to maintain all of the offices and locations that they previously had open because they just can't staff either that labor and delivery unit or that office where their patients access prenatal care. And they're concentrating their efforts and their staffing of physicians as well as other staff members to their clinic because of that. And there's more of that to come for sure, considering that not only are we having all of these obstetricians leave, but we are not replacing them at the rate that we would need to.
Yeah, and I want to dive into that a little bit more because this report came out just before the news broke that a labor and delivery unit in the Treasure Valley would be closing, West Valley Medical Center in Caldwell. Now, in this case, the hospital is not saying whether the bans affected staffing problems, but you've alluded to that. So, do you think that is part of that decision or part of that closure?
We know, I think it's clear from our report out of the Wellbeing Collaborative and the coalition that if you are losing obstetricians in the state and you're not replacing them, that can put particularly smaller programs and smaller labor and delivery units at risk. Hospitals in the state, including some in the Treasure Valley, that rely on a small group of physicians to provide 24/7 call because that's what you have to provide, obviously. And all it takes is, losing one or two of those providers in that call group, and it becomes untenable for those who are left. And if you can't recruit back into that group, that program is at risk or needing to close. It's very difficult to fill those positions. I know that there have been openings for OBGYN physicians in the Valley that have been open for greater than a year without
Really?
interviews for providers. This is happening. There isn't, and in the past, this was a very popular place to practice OBGYN, Idaho in general, and particularly the Treasure Valley and surrounding urban areas. Idaho is growing. Obviously, there's many things to love about, the lifestyle, the schools, the support, things that we've enjoyed, all of the outdoor activities. There's always traditionally been a large draw for all physicians, but particularly OBGYN physicians. And I've been in Idaho 20 years. I did my residency training in the Boise area. And the problem was typically not this one, it was the opposite. Would we have enough patients to keep all of these OBGYNs busy in those days? And now we're seeing the stark opposite.
Does Monday at the office feel like a storm? Not with Microsoft Copilot. That feeling when Copilot gets everyone up to speed instantly? It's sunny again. When Copilot simplifies complex data so your teams can act, that sun's shining on a beach. And when Copilot uncovers hidden insights, you're on that beach with your people, and you find buried treasure. That's Microsoft Copilot. Learn more at Microsoft.com/AI for all.
This episode is brought to you by JLL. Get an insider view into the world of commercial real estate with JLL's podcast, Trends and Insights, the Future of Commercial Real Estate. Whether you're curious about making cities more sustainable, the evolution of office space, or AI opportunities, this podcast will help keep you a step ahead. Tune in for candid conversations with business leaders about the biggest trends impacting how we live, work, and play. Subscribe to Trends and Insights now at jll.com/podcast.
The West Valley Medical Center isn't the only hospital that's closing their labor and delivery unit since the Dobbs decision. In North Idaho, Bonner General Hospital closed their unit first, and then Valor Health in Emmett closed theirs a few months later. Can you explain to us why would abortion bans lead to doctors who deliver babies leaving? In other words, can you explain for someone who might not be very familiar with this type of healthcare, can you explain the link between abortion care and labor and delivery care?
Yes, thanks for that question. Sometimes folks in the community and folks within medicine think of abortion as, separate completely from the practice of obstetrics. But it's the opposite. It's essential to the practice of obstetrics in that when complications occur that are life-threatening, time-sensitive, and often unexpected in a desired pregnancy that has gone into its second trimester, in many cases, there can be instances of bleeding and threatened miscarriage that can become severe, can lead to severe hemorrhage and be health, fertility, and life threatening. There are instances and complications of pregnancy which result in severe infections that can likewise threaten health, their future fertility and ability to have children or another pregnancy, and even become life threatening because infections can lead to a severe syndrome called sepsis, which, if not acted upon rapidly, can result in organ failure and ultimately death. So the practice of obstetrics hasn't ever changed in that it has these risks. The pregnancy often is complicated, but what we know is that can often be unexpected, and sometimes it happens to those who are least anticipating those complications. And so it's part and parcel of practicing obstetrics. So if you imagine yourself, being on call, any patient that walks in the door potentially could have a severe pregnancy complication that could put you in the throes of these laws. If a physician faces that consequence, that criminality for the care they may need to provide on any given day or any week of the year, ultimately that stress and that burden of running into conflict with the law, of potentially having to get on the phone and speak to hospital lawyers about whether you can provide the care that you think you might need to provide, maybe in the next 5 minutes, maybe in the next couple of days, depending on the situation. And that's what drives this exodus of providers, because ultimately there's only so many days of the week and weeks of the year that you can face that threat, right? Because they don't want to be caught between the practice of medicine and the law, even if at the end of the day, the care that they provided is found in a court of law to be life-saving. They've undergone an entire deliberation and process under which that care was scrutinized.
Now, I've heard some people respond to this news by claiming that this has nothing to do with Idaho's abortion bans, that labor and delivery departments around the country are closing and doctors are leaving because fewer people are having babies and these departments are just not as profitable. What's your response to explanations like that?
I think certainly that we have been facing an issue prior to the Dobbs decision, prior to Idaho's abortion bans going into effect, that particularly smaller hospitals and smaller labor and delivery units face economic struggles. There's no doubt about that. That trend has been well studied over, the last couple of decades. But I think that it's undeniable that this is a dramatic shift. Again, when we look statewide, when we look how this is affecting not just rural hospitals and small hospitals, yes, they're going to be the most vulnerable to close for the reasons that I explained before. When you have a staff of 4 OBGYNs, if you lose one or two, that is going to threaten a program more immediately and more directly. But we're seeing this have an effect in the Treasure Valley, in a place where we've always been able to staff obstetricians. Now patients are facing situations where they're going to get in where they can. And that's directly related to the fact that Idaho has become a less desirable place to practice medicine. And it can be obvious to folks that while we have faced in the past changes to medical practice, changes to the way reimbursement happens in medicine, other non-criminal changes to medicine that make it harder to practice, never before have we faced criminal charges or potential criminal charges for the care that we have provided, that we were trained to provide, that comes up often in the hardest moments in our patients' lives. So that's a very dramatic shift. And again, there are places in the country where this isn't happening. We have neighboring states that don't criminalize their physicians. So it becomes a real test of how can this state continue to push back and explain this, explain that medicine itself can monitor the best care and the standard of care, and that criminality of medicine is not the way to provide the outcomes that anyone is hoping for.
Absolutely. Absolutely. So, for women and people in the Treasure Valley who are hearing this, who are pregnant or might want to become pregnant soon, how concerned should they be that they might struggle to find a provider or even lose their current doctor?
I think that that concern is very real. Now, we certainly don't want to scare patients, and we are absolutely here. There are many of us who are finding ways to stay for the time being, and we're actively working towards change. We're speaking at the legislature every day, but I think it is really important for patients who are early in their pregnancy, don't have a provider yet, who are considering becoming pregnant, to establish with a practice if they're able to do that sooner rather than later. We really want to be able to provide that care. So the awareness is important, and the speaking to your practice that's still there and your physician that's still there providing that you're concerned about this issue is very helpful. And speaking to your local legislator about your concern about the care that you may need to receive or family members, that really does matter. And we're asking people to be vocal about that with their legislators as well as their healthcare team.
Perfect. Thank you so much. Those are fantastic insider tips for navigating this new atmosphere of healthcare that we have. And when we talk about OBGYNs, obstetrician gynecologists leaving Idaho, I know a segment of the population is undoubtedly thinking, well, I'm not pregnant or planning on getting pregnant, so this isn't going to affect me. What would you say to them, or why should they care?
Yeah, that's a great topic to bring up because we do hear that and feel that at times, though I think there's a growing realization that this issue affects everyone. And that's twofold from the standpoint of anyone accessing medical care in general, this has an effect. When we live in a state that criminalizes one type of care, we know that there's potential for other care to be criminalized. And we're seeing that already play out with other issues, specifically in pediatrics and access to that, to pediatric care and other areas of medicine as well. So there's the impact on medicine as a whole. I'll also say to that point that many obstetrician gynecologists or family medicine docs who provide obstetrical care tend to be partnered or familyed with other healthcare providers. And so we're not just losing the 50 obstetricians in Idaho that this report details. We're often losing providers from other specialties and other healthcare team members, nurses, respiratory therapists. There's an impact and a trickle down to the entire healthcare system. And then lastly, I will say that everyone knows someone who has been pregnant, who is pregnant, who wants to be pregnant in their family, in their peer group, in their place of work. And so while that may not affect you personally or your family is complete and you are done with your childbearing, this does have a trickle down in our family networks, our social networks, and in our communities. And so the impact there is very large.
And you've mentioned the criminal charges. I just want to remind everyone that the criminal charges are up to 5 years of jail time. And then there are also civil penalties of lawsuits for up to $20,000 per family member of the patient. And so we talk a lot about the doctors who leave, but what is it like to stay and practice medicine under those laws?
Yeah, as a family physician who provides obstetrical care, I feel this very acutely. I feel it in my rural hospital, we take days at a time of call because we're a relatively small hospital and a small team that provides that care. And I think about it continuously. Who may come into the ER? Which one of my ER colleagues is going to be placing that call to me saying that they have someone in the emergency room who's hemorrhaging or that is severely infected, who is developing sepsis. And from this instance of the rural hospitals, we have another challenge, which is, getting that patient to a higher level of care, which often involves an air transport. Another aspect of this care that's important to talk about, because while that definitive care for those emergency situations prior to this could have been provided in my hospital situation, or I could have transferred that patient to a larger hospital in Boise to a provider able to provide that care. Now we're looking at sending patients out of state. Not only is that expensive, but that is a enormous burden on a family in regards to the potential cost, as well as what that means for their life in that moment and their family's situation, whether that requires extra childcare, bringing family in to help with that, more time off from work than would be necessary before. And sometimes, this information hasn't gotten to families. And not only in that moment are we breaking the news that we can't care for people at home with their physician and their hospital or their hospital system, but they're just learning for the first time that these laws actually impact them and their family.
So it sounds like you plan on staying and continuing as a doctor despite everything.
As a family medicine obstetrician here in my community, I'm starting to take care of, multi-generations of that family and deliver babies into those families. That brings me great joy, but that's not without trepidation. The way I've found through all of this to continue in Idaho and to stay here is to be vocal about these issues, to keep up the hope that we can bring the message home to our communities, that our communities can bring the message home to our legislators, that this isn't a situation that can continue, that it's untenable for physicians, and that it's unsafe for individual patients, families, and their communities, and that we can affect change through bringing that message out and folks getting a greater understanding of the impact of the criminality surrounding obstetrical care specifically, but also in medicine as a whole.
Wow. Thank you so much. Thank you for taking the time to be here. And that's really powerful how you are not only practicing medicine, but also trying to inform communities and being so vocal about this. We appreciate you taking the time to be with us today.
Thanks, Lindsay. It's great to be here.
That's all for today here on CityCast Boise. If you enjoyed the show, tell your friends about us. We've got some amazing shows coming up with need-to-know local information. We'll be back tomorrow morning with essential tips for how to survive Boise. Catch you then.